Hi, my name is Miguel Mazo. I'm one of the bariatric surgeons with Longstreet Clinic in Gainesville, Suwanee, and Brazelton. I've been asked to talk today about some of the more common questions we get in the world of bariatric surgery. Today's question is, what can you expect when it comes to pouch size or sleeve size long-term after a gastric bypass or a gastric sleeve? Very common question. People wonder, can you stretch out the new changes in the anatomy that were made during the time of the bypass or sleeve creation? And it's kind of an interesting question to me because I think the stomach's designed for a certain amount of stretch. When we eat with a standard stomach, there's gonna be a little bit of stretching that goes on there. That's a normal part of the digestion process. And after a sleeve or a bypass, that's gonna happen again. But I don't think that the stomach chronically deforms. It doesn't change its shape or size long term in a way that we can't work with the patient to restore. So you can imagine after a standard meal, you eat, you get full, the stomach then digests that food, the stomach gets smaller again. Long term with a gastric bypass or sleeve, the same process is happening, but over time, you can train that stomach, that new stomach, that pouch, that sleeve, to accommodate more food. And the way I describe it to patients, think about those guys who eat 80 hot dogs on July 4th for competitions. They've got the same size stomach that I do. If you were to put a camera down the next day and look at their stomach, it's the same as mine. But what is different is their stomach can stretch and stretch and stretch and not complain, not cry out and say, hey, quit eating. And so they're able to compete in food eating competitions. I couldn't do that. A sleeve or a bypass long term, it's possible over time to train it to not be as upset about going over the 4 to 6 ounces we recommend per meal. And so getting a patient who's doing an 8-ounce meal or a 10-ounce meal or a 12-ounce meal back down to a 4 to 6 is usually a process of training and retraining the stomach by decreasing portion sizes, picking good satiety level foods like protein, vegetables, watching out for the breads, rice, pastas, and potatoes. So it really isn't so much the stomach stretches and deforms, but that it basically does the job you ask it to do, and it gets better and better at that job. So one of the questions I get from sleeve patients and bypass patients is, can my new pouch or my new sleeve go back to the size it was before surgery? In a sleeve surgery, you are resecting or taking out about 4/5 of the original stomach. And so no, it's not possible to stretch out that much over again. A bypass patient, the pouch is about 20 to 30 milliliters in size compared to a stomach that's normally about 1 liter in size. So it's much smaller than the original stomach. So no, there's not an amount of stretching that goes to the degree that the original stomach would have, but it's more about what the stomach learns to accommodate without complaining about.